Dealing with neuroanatomy, or if you've ever struggled to grasp concepts, then this video might be for you. The first and the most important question to answer is, why do I care? What is neuroanatomy? Why is it so difficult? And why do I need to study it if it has such less weightage in the exam? Let me tell you what I wish I heard when I was in first year. So first is to localize the lesion. Let's say you're an intern in the emergency department and a patient comes to you with unilateral or bilateral droopy eyelids. The patient is not going to tell you, I have a lesion in my midbrain. Speaking of which, lesion is just a term which means defect. It can be an anatomical defect. It is just used to denote where the pathology is. So only if we have certain knowledge of the anatomy will we be able to locate where the pathology is and what might be wrong with someone. Then, to understand pressure symptoms, stroke, here's a simple concept. We know that increased intracranial pressure causes vomiting. But do we really understand the mechanism behind it? What is it about the increased intracranial pressure that is actually resulting in the vomiting? So this physiology can be better appreciated with the knowledge of anatomy. And lastly, cranial nerve nuclei. The importance of this cannot be overstated. Okay, tell me what to learn for exams. If I'm going to talk about professional exams or university exams, these are the topics according to me that are important. The transverse section of midbrain pons and medulla, which constitute the brain stem, as you might know. External features, more for practical aspect, not so much for theory, but you can get MCQs. Cerebellum, external and internal features. Cerebrum, you need to know almost everything about it. The cortex, white matter, blood supply. Floor of fourth ventricle is an all-time favorite question. And of course, internal capsule, because this was asked in our university exam. Okay, I don't even know what is tract. How do I start studying neuroanatomy? I think I can help with that. So what is a tract? Tract is basically collection of axons. So if you remember your structure of neuron, we have something like this, and then axons. This is very poorly drawn, excuse me, and then dendrites, right? So this is an axon, while this is a cell body. Here's a simple fact. Axons appear white, while cell bodies appear gray. So when you say white matter, like if you look at spinal cord, it's white on the outside and gray on the inside. So what does that mean? It means the axons are coming from out and all the cell bodies are towards the center. Whereas same thing, if you look at the brain, it's the opposite. I wrote brains. So in the brain, outside it appears gray, but on the inside it has white matter. So this is one basic fact. What is a fascicle? Fascicle is a lot like a tract, but it literally means bundle. So, in the medulla, there is a fasciculus gracilis and a fasciculus cuneatus. Cuneatus is lateral, gracilis is medial. How do you remember this? So, let me tell you the story behind this. The gracile fasciculus or gracilis refers to graceful. Because it is slender and placed medially, this is called the gracile fasciculus. Whereas the lateral one is closer to the brain, if you think about it. It's closer to the cortex, right? Which means it's kind of cunning. Hence the name fasciculus cuneatus. I am not making this up. This is literally the history behind how these structures got their names. So that is another interesting way to learn and remember stuff if you're into that kind of learning. Then a nucleus is just a collection of cell bodies within the CNS. So collection of axons was a tract. A collection of cell bodies is a nucleus. So one question might arise, what do you call collection of nuclei in the PNS, or in other words, collection of cell bodies? The answer is simpler than you might imagine. Ganglion. So tract, fascicle, nucleus done. What's a colliculus? We keep hearing this name, right? It just means swelling. Best example for this is facial nerve. If this is the facial nerve nucleus and this is the facial nerve, which you might know is the 7th cranial nerve, this is the nucleus, right? And this is situated somewhere in the pons. So the 7th cranial nerve goes and hooks around the abducens nucleus. So this structure in blue is abducens. And externally, this whole thing forms like a sort of bulge or a swelling. I'm not able to show it in 3D, but you get the idea, right? So this facial nerve hooking around the abducens nucleus and reaching the facial nerve nucleus, this whole structure together is called the facial colliculus. Similarly, you have a superior colliculus in the midbrain, and inferior colliculus. So colliculus basically means swelling. Now I don't even know what is dorsal ventral. How do I get started? Dorsal just means posterior and ventral means anterior. So if you look at any neuroanatomy diagram, this is how you read it. This is more ventral and this is dorsal. That's why fasciculus, gracilis and cuneatus are placed right on top, which is why they are called the dorsal column. There's actually a special name for this column. Comment down below if you know that name. Right. Similarly, the dorsal spinocerebellar tract is, placed higher up in the image. Lower down is the ventral spinocerebellar tract, right? So dorsal ventral confusion is also sorted. Reticular formation. Reticular, usually this word refers to network. So reticular formation is nothing but a network of neurons which regulates your autonomic functions, sleep-wake cycles. That's where we get our term RAS also, reticular activating system. Okay, so these are some basic terminology that I could think of. Now, how do we read neuroanat sections? Like I said, if you have a structure like this is ventral, this is dorsal. Okay? Please don't mug it up. Everything has a certain meaning and significance to it. If you try to understand that meaning, you will be able to correlate and remember the diagrams better. And yes, diagrams are important for all of this. Maybe not cerebellum, not so much. You still need the vernix and everything. So all of it is important, diagrams. Integrated with CNS physiology. So let's say you're learning the pyramidal tracts. And here in the medulla, you see pyramids. It's the same thing we're talking about. So if you try to integrate and learn, you will understand both anat and physiology better. And no half diagrams. I've specified this because Vishram Singh Gross Anat textbook has a lot of diagrams that are sort of cut in the half, looking something like this. Those diagrams are not acceptable for your exams. People should say this more often. Please learn complete diagrams, preferably from Indivir Singh Neuroanatomy textbook. I would say that no conversation about neuroanatomy is complete without this diagram. This is a diagram showing where each cranial nerve nucleus is located, in which part of the brainstem. I found this very useful and I used this to learn the transfer sections of everything. So please do join the Telegram channel if you want this diagram and more notes and updates on videos. I hope this was helpful in some way, and I think after this video my 2-minute neuroanatomy reels will start making more sense. Hope you liked it. Thank you for watching. Bye.